we also run the risk of messing up their electrolytes. All right, so the sodium levels can mess up. Some diuretics, we lose a lot of potassium, okay? And we'll talk about the different diuretics, but loop diuretics, like Lasix, y'all heard of Lasix? So, the generic name is furosemide, but Lasix is a loop diuretic. Everybody snap with me. Wait, you got me on mute.
I'm
Ready? Y'all ready? Let's go. Loops make you lose potassium. Loops make you lose potassium. Y'all like that beat? Loops make you lose potassium. So loop diuretics are what medications? Furosemide or Lasix, and they're gonna make you lose potassium. Okay? So anytime somebody's on a loop diuretic, they're gonna be losing fluids, right? But they're also gonna be losing potassium. So what I need to give them? Potassium. Okay? So I can either give them a potassium pill, or I can tell them to eat foods that have a lot of potassium, like what? What's got a lot of potassium?
Bananas.
That's everybody's first go-to.
Bananas.
Yeah, right? But it's also cantaloupes, it's also apricots, it's kale, it's dates, it's potatoes. Y'all know that song, green beans, potatoes? All this got potassium in it. That's it? All right. So that's the biggest issue with diuretics. I'm worried about their fluid status, right? Am I taking off too much fluid? Okay? Am I messing up their electrolytes? Am I taking away too much sodium? Am I taking away too much potassium? Okay? And they gotta have access to either a urinal or a call light, because when I give them a diuretic, guess how fast it works?
Quickly.
Very fast.
Yes.
So when they take it by mouth as a pill, it's fast. So if they're getting an IV push,
It's
it's
super
even
fast.
faster. So if I know that my patient's gonna be on a diuretic, I wanna make sure they have access to a bathroom. Make sense?
Yeah.
What if they're immobile or have mobility issues? What should I do?
Put a brief on
I put a brief on,
Bedpans.
bedpans. If
it.
they
You ain't gonna
get-
make it with that bedpan, big pen like that.
Some people can't hold it long enough.
You gonna be in there every 15 seconds.
Well,
If you have high doses of diuretics, I may even ask for a Foley catheter, right? Because they're gonna be going. If it's high levels, like Lasix, it works fast, like super fast. If they got mobility issues, and we know that it's gonna be a problem with them trying to get to the bathroom, I may ask the doctor for like a temporary Foley catheter so they can go a little easier. And I don't have to worry as much about safety. Make sense? Because they're gonna be going to the bathroom a lot. What time of day should they take the diuretic?
In the morning.
I'm telling about my mama though. Y'all, she really pisses me off sometimes. So of course she's on a diuretic. And it's like she always finds something to complain about. So she plays the organ in New Roads. So she has choir rehearsal on Wednesdays. So we live in Baton Rouge, so she gotta drive all the way to New Roads. Why she drive all the way to New Roads to play at church? I don't know, they got no churches in Baton Rouge, but that's all. And then Sundays, you know, she got her driveway. So she takes a fluid pill every morning, except for on Sundays. And then she always calls when she get out of church. "Ooh,
She's swollen.
I'm all swollen. Yeah, doctor, Mom, you take it. How am I supposed to take it? I got to drive. Okay, all right. Do something. So I did buy her, like a little, like portable toilet thing for the car. But I can't use that. Okay, you know what? Just be mad. All right. So if we have a patient that, you know, is worried about getting up several times during the night, we always tell them to take it in the morning. But sometimes we have those patients who has a job to where maybe they can't go like that. We want to provide some more education, give them some alternatives, tell them, okay, maybe take it more towards the afternoon, but I don't want them to take it when?
At night.
Because they're gonna be up, okay? All right, so after we give it, of course, I wanna check their vital signs. I wanna check for orthostatic hypotension, all right? Because when you lose fluids, your blood pressure is always gonna drop, okay? So I want them to change position slowly, okay? I wanna monitor their INOs, okay? Why am I monitoring their INOs? See how much fluid they lose. What if, when I'm doing their INOs, their intake is way more than their output, and they're still on a diuretic.
That
What does that
mean
mean?
they retaining the fluid.
They're retaining it and something's not working, okay? If they start gaining more weight when they're taking a diuretic, that means instead of them excreting it, they're retaining it, okay? And what should we have to do? Or what can you think about, what do you think the doctor's gonna tell us to do?
Put them on fluid restriction for one. No, no.
So I heard somebody say it, an in and out catheter.
Oh yeah.
So it may be that the kidneys are still working, the kidneys are still excreting it, but sometimes patients can't feel when they have to go. And so instead of them, expelling it, it's all in the bladder, but it's just stuck there. Make sense?
But the catheter's gonna just pull it out?
Yes.
Yeah, they'll do a bladder scan, see how much is in there.
That's for inpatient though, so what do you do if you're outpatient?
Oh, well, that's what we teach the patient. I need them to weigh themselves every day. And if we see that they start gaining like 5 pounds in a day, then that's a problem, okay? They need to come into the doctor, we need to see what's going on. Make sense? Questions? So the major issue with diuretics, any diuretic, why are we giving any type of diuretic?
To excrete
So I
the,
wanna get rid of some fluids, right? What's the issue with getting rid of fluids though?
Can mess up your electrolytes.
So it
Can
mess
drop
up
your
my
blood
electrolytes,
pressure.
drop my blood pressure, I can go into dehydration. Who's most at risk for dehydration?
Elderly.
Older adults, okay? Who's most at risk for safety issues when they're on a diuretic?
older people.
Older adults or anybody who has mobility issues.
Right.
Okay, anybody who can't get up and move around, very well, because when they gotta go, they gotta go, okay? Make sense? All right. So again, we want them to take it when? In the morning, or as close to the morning as possible, because, some people work. Oh, it was soft, okay, I'm sorry.
Yeah, you did.
I did.
You said 5:45.
I'm sorry. You didn't miss much, my bad, I'm sorry, I did say 5:45. All right, we just started. So y'all, last year the doctor put me on Lasix. Did you see me roll my eyes?
You look like your mama now.
And he made me so mad, because, after my son died, I had a lot of heart issues. And a lot of times when you have heart issues, what happens? You retain fluid, right? So I came back, he was like, and these are his exact words, "You've gained a substantial amount of weight." He started pushing, "Ooh, you're all puffy, got a whole lot of fluid, don't you?"
I'd have choked him with the stethoscope.
So he put me on Lasix, and he said, "So I need you to take this in the morning, every morning." So y'all, for a little while, I did turn to my mama. I said, "Okay, so here's the thing. I'm not gonna be able to take it like every morning because I teach." He said, "Well, don't y'all get breaks?" Yes, but when you take Lasix, when you gotta go, you gotta go. Can y'all imagine me if this was like the morning I took Lasix and I'm in here talking like, "Excuse me, y'all, I'm trying to get out of here." But yeah, you want them to take it as early in the morning as possible, but just not at nighttime, okay? And we gotta kind of work with the patient, because if they have a job to where they can't keep stopping to go to the bathroom, then you want to just kind of encourage them to take it as close to the morning as possible, because I just don't want you to be up at night using the bathroom all night. Make sense? All right, so we tell them to never double dose. So let me tell you about my mama again. Remember I said on Sundays, she don't really, so she's supposed to take it like twice a day. So in the morning on Sunday, she doesn't take it. So she says, "Well, I'm just double it up when I get home." What's the problem with doing that?
She gonna be so dehydrated.
Dehydration,
And she gonna be super pissy.
that too. Literally and figuratively. All right, that blood pressure gonna drop. Okay, so there's a whole lot of issues, all right? So we never tell them to double a dose to make up for it, all right? Because that can cause more harm than anything. Make sense? We want to report hypotension signs and symptoms. So if they become extremely dizzy, then their dose may be too high. Okay, if they become extremely dizzy. We want to manage orthostatic hypotension. So we tell them to stand up slowly, change position slowly. Why? Because they're losing fluids. When they lose fluids, what happens to your blood pressure? It drops, okay? You want them to weigh themselves daily. Why are they weighing themselves?
So
To make sure they're not retaining fluid.
retaining.
To make sure they're not retaining that fluid. Because the kidneys may be working, it may be treating it, but it may be the bladder that's not releasing it. Make sense? Okay? And then I want them to drink a normal amount of fluid, okay? Sometimes I tell them to increase their fluids, all right? But I never tell them to decrease their fluids, okay? Unless they're on a fluid restriction by the doctor, which is something totally different. But typically, if I'm gonna be taking fluids away, I still need to make sure that they don't become dehydrated, right? And what I say about loop diuretics, what's another thing that we watch for?
Potassium.
This make you lose potassium, okay?
So I have a question.
What you got?
A lot of our dialysis patients, they'll like, instead of get water, they'll ask you, can they just get ice? Is that the same? Cause I mean, it's still frozen water, but like they really eat ice like throughout the day.
That's another way to keep them hydrated. It's hard to drink. See, I've been trying to drink this water all day. It's hard to drink water for some people, but it's easier to eat ice. Does that make sense? Especially if, like when somebody's dealing with nausea, although we still gotta keep them hydrated, it's easier for them to eat ice chips as opposed to trying to gulp down some water.
Especially with dialysis, because it already makes you nauseous. That's probably why they ask for the ice.
They be eating that ice like crazy.
All right, so they have all different types of diuretics, all right? So the diuretics that I want you to know are thiazide diuretics, loop diuretics, potassium sparing diuretics, and osmotic diuretics, okay? So thiazide diuretics work very similarly to loop diuretics. So I said loop's gonna make you lose potassium, right? Thiazide diuretics, you lose potassium as well, not just not as much as with loop diuretics. So some examples of thiazide diuretics are hydrochlorothiazide, okay? So thiazide diuretics have thiazide as a suffix, okay? Works very similarly to loop diuretics, so you're gonna be losing fluids, you're gonna lose sodium, okay? And you're also gonna lose potassium, okay? So somebody on a thiazide diuretic, what do I tell them that they should eat?
Potassium,
Foods with potassium in it, like
bananas, kale,
kale,
cantaloupe.
dates, apricots, potatoes, green beans, potatoes, tomatoes, all that. Okay?
You said they lose potassium, what else?
They're gonna lose sodium, because that's how it works. They're getting rid of sodium, and the water's gonna follow that sodium. But potassium's always also gonna kind of sneak out as well. Not as much as with a loop diuretic though, okay? So thiazide diuretics. A lot of times when people are newly diagnosed with hypertension, if they have to be on a diuretic, they're gonna put them on a thiazide diuretic first, okay? Because it's not as potent or not as strong as a loop diuretic. It's a little easier to handle. You're not losing as much potassium. Make sense? A lot of times too, thiazide diuretics are combined with their other high blood pressure medication. So it may be a combination medication, and it say like, it'll have like a high blood pressure medication / HCTZ, which is hydrochlorothiazide, okay? So when we have patients like that, you're taking a blood pressure medication and it's combined with the fluid pill, what do we really have to watch out for? Blood pressure dropping, because they got a blood pressure medication and they have a fluid pill that's also gonna drop that blood pressure. Make sense? So thiazide diuretics, you're gonna be losing sodium, and when you lose sodium, you lose water. You're gonna lose a little bit of potassium as well, okay? What's the suffix for thiazide diuretics? Thiazide, like hydrochlorothiazide, okay? Then we have,
Loops make you lose potassium.
wait, no beat, but okay, yeah. Okay, we got loop diuretics like Lasix, so furosemide, torsemide, all right? The main medication that we give that's a loop diuretic is furosemide or Lasix, okay? What's the major issue with a loop diuretic though?
Make sure you
You're
lose
gonna lose a whole
potassium.
lot of potassium. So what should I teach my patient?
Take in a lot of potassium.
They gotta take a lot of potassium. Should I also teach them the signs and symptoms of a low potassium?
Yes.
Alright. Too much potassium is an issue, but more so with the potassium sparing diuretics. Alright, because we know automatically with a loop diuretic, they're gonna lose potassium. Alright, so before I wanna put them on a potassium pill, I want them to eat more potassium. Okay, I want them to eat more. So I tell them, some of the signs and symptoms that when your potassium is low, the first thing that's gonna happen is you're gonna start getting muscle cramps. Okay,
Charlie Hall.
and they hurt.
Very much.
Lock you up.
So the problem with losing too much potassium though, is it causes muscle cramps. What's an important muscle in our body? Our heart, right? So whenever we have too low potassium, then our heart, we start to have chest pains. We start to have dysrhythmias. Our heart starts beating all out of rhythm, and that's a whole nother issue. Okay? So when they're on a loop diuretic, our main issue is keep their potassium up. Okay? So what do you think some things we should check? The potassium level, right?
Potassium level.
I need to check your potassium level. So that's something I'm always gonna be doing. I'm gonna be asking them about muscle pain. I'm gonna be asking them about their diet. What kind of things do you eat? Okay? Sometimes though, that loop diuretic is super strong and no matter how much potassium they eat, they can't build it up. So then we gotta put them on a potassium pill. Okay? Sometimes it's like, y'all see those big horse pills. Potassium pills are huge. Okay, but they can be crushed, but they're huge. They also have potassium liquid. What you got?
So when you say muscle cramps with the potassium, if it's lost too much, I'm on hydrochlorothiazide, but I still have high blood pressure. So I have a lot of muscle cramps, but it's be like in the back of my leg. So that's the same.
Yes. So you're on hydrochlorothiazide, so it's because you're losing potassium.
So I have to get off it. I don't need it.
There you go. There you go.
That is not what you go on with this.
Now how they work.
That is not what I said. So you still.
I'm on it. I'm still taking it, but it's like my pressure's still high and I don't feel like I'm fluid.
Well, that's, you gotta talk to your doctor about your dose then.
It's a minimum dose they give everybody, like 12.5. My husband on, my dad on, my mom on, so now.
I think they go up to 25 after that.
Yeah, you need to, tell them that your blood pressure, you still go to your, like, the checkups and stuff?
I'm not running out of my pills.
See, this, see.
Just
Tell the whole story.
Mama Junior.
Tell the whole, mom, just tell the whole story. Do you check your blood pressure daily?
No.
See, that's what I'm talking about. So, whenever we're taking this test, and we're talking about blood pressure medications and fluid pills, what's one thing the patient needs to be doing?
Checking their blood
Their
pressure
blood
daily.
pressure, all right? Keeping up with their doctor appointments, not just when they run out of pills,
Weighing themselves daily.
weighing themselves, all right? So, yeah, you need to make an appointment.
It's not think I'm taking it for nothing. But when I don't take it, when I miss a couple of those, it goes up higher.
Doing a little something.
So it's working. It's trying to work. You take it every day? See, this is what I'm talking about. This right here. See the kind of questions you gotta ask your patients, because they're gonna tell you a little bit of the truth. I'm on it, but I still got high blood pressure. Then you gotta start digging. Well, how often do you take it?
I get up too early in the morning to take it. I get up at 4:30 in the morning to get ready for work and I don't have time.
So you see?
But then I got it mixed up in a pill bottle with 5 other pills.
Wait!
That's the black women for you.
Nah,
You know I ain't lying.
no. You're not gonna stereotype us. No,
We
ma'am.
don't stereotype this.
I'm not putting everybody in your
Uh-oh.
population, but you know who you are. It ain't you don't talk.
I can't stand
I
her.
have phosphorus, which is white, small tablet. The hydrochlorothiazide is pink. And I also have a menopause tablet that's brown. And
Pause. Pause. Okay, so, wait, y'all listen. This goes back to the test we just took. She said she got a menopause tablet that she takes, right? What's probably the main
You
ingredient?
can't take it if you have hypertension. I got that wrong.
But that's
I don't know. I don't even think I answered it. I think I froze on it and forgot to go back to it.
it's a herb tablet.
I'm being honest.
I know I got it wrong.
Oh, yes,
So that should be.
okay. Yeah.
Me too.
Like, how much cost is
I, you know what I think?
All right. So, when we thinking about patients, and we're talking about high blood pressure medications and fluid pills, one, we gotta make sure that they are compliant and adherent. Because a lot of patients will say that, not just, a lot of patients will say that, it's not even working. Knowing good and well, they don't take it every day. They got it mixed up in pill bottles of other pills. I don't know how that happened, but, so those are some of the questions that we have to ask, okay? All right, questions. There's carbonic anhydrase inhibitors that's usually used for glaucoma, all right? But I'll talk about that when we go back to like the eye medications.
So wait, what was it? The loop?
So,
Loop and.
thiazide diuretics, loop, potassium sparing, and osmotic, okay? I'm gonna talk a little bit about potassium sparing, all right? When you spare something, what do you do?
Give a little bit.
You save it.
Rationalize
I'm
it.
gonna spare his life, all right? So potassium sparing diuretics are going to save potassium. So instead of losing it, you're holding on to it. So what's the problem with holding on to potassium?
You can,
Now, that's good.
It's
That's
gonna-
so.
You're gonna,
I guess keep.
You don't have too much potassium. So remember I said too little potassium is dangerous, right?
Yeah.
Too much potassium is also dangerous.
You have a heart
Just
attack.
don't breathe. Just, I mean,
so
Yeah.
you.
That's what they use for lethal
That
injection.
is what they use for lethal injection. That's why we never give, that's what actually kills them. So that's why we never give potassium IV push, because you will kill somebody.
It's always in a banana bag. You call it
Right, it's always mixed with something. So, potassium sparing diuretics, we tell patients, okay, you're gonna be holding on to a lot of potassium, so I don't want you to eat a lot of potassium. So it's the opposite of people with thiazide and loop diuretics, okay? If they're on a potassium sparing diuretic, they're gonna be holding on to potassium. So do I want them to eat a lot of potassium? No. Make sense? Do not get that confused, okay?
Example of one of those medications. What is a potassium sparing diuretic medication?
I'm gonna get into it. All right, let's talk about thiazide diuretics first, all right? So remember I said the suffix is thiazide, right? Then we have like an outlier, but the major thiazide diuretics, the suffix is thiazide. The number one that we give is hydrochlorothiazide, all right? So why do we give it? I want them to increase their urine output because I want them to get rid of fluid, okay? I want their blood pressure to be lowered, right? And it says the urine's gonna be lighter in color, why? They're hydrated and they're still going, okay? I don't want it to be like a real dark color, because that means there's a problem. They're still not filtering and eliminating the urine like they should. Make sense? All right? What they're gonna be losing when they're on a thiazide diuretic?
Potassium.
What else? And sodium, okay? Because sodium is how it works, right? Gets rid of the sodium, water follows it, and then potassium kind of sneaks out too. Make sense? All right? So again, we have those fluid and electrolyte imbalances. Okay, I worry about them being dizzy, muscle weakness, and blurred vision because they're losing fluids. Now y'all,
is that why it says for patient teaching, limit exposure to sun when you're on a diuretic?
yes, tell me why.
Because you're at risk for dehydration, right?
Correct. Look at you putting it together.
You don't get it wrong.
I ain't gonna answer it.
Look, I gave her a chance.
give the
I did that
away.
one too.
All right, remember I said because they're losing
I
potassium,
saved
you
them
check
for
it, right?
last.
Their potassium is low, I need to hold it and notify the physician. Because too low potassium can impact that heart. They're gonna start having chest pains, the heart's gonna start beating out of rhythm, okay? And sometimes when people have low potassium, they become very irritated. That's like one of the signs that you know something's going on with their electrolytes, okay? Of course, afterwards, I'm still gonna be checking their potassium levels, right? Okay? Of course, I'm gonna teach them about signs and symptoms of low potassium. When they start getting like those muscle cramps, their potassium is probably low, okay? And if they're taking potassium supplements, I need them to take it every day, right? Because if they're taking that, hydrochlorothiazide every day, they're gonna get some potassium every day. So I need them to replenish it, okay? So here's the thing about potassium supplements. It causes a lot of GI upset, okay? It's really, potassium, it burns.
Yeah,
Okay.
a lot of patients complain about it whenever they get it.
Yes, so when it's going through the IV, it burns. It also messes with your GI tract, okay?
A lot of medicine can be toxic and have GI upset, so you.
Yes.
It's hard.
It's hard, that's why we gotta stay as healthy as possible for as long as possible. So, sometimes potassium can be in a liquid as well, but we always kinda tell them to take it with food and juice and stuff like that because it's so irritating to the GI tract, okay? That's why we try to get them to eat more potassium first before we put them on potassium supplements. Make sense? Questions about thiazide diuretics? Pretty easy, yes? Okay? Of course, pediatric patients, their dose is always based on weight. It's not recommended in pregnancy and breastfeeding. Why you think?
Because the lactating.
What else? We don't want them to lose a whole lot of fluid when they're pregnant, right? Because a lot of times with pregnancy, the blood pressure drops. Although we have like those who have like pregnancy-induced hypertension, preeclampsia, that's something totally different. But a lot of times when you're pregnant, your blood pressure gets a little lower, okay? And then when you're breastfeeding, I need their fluid to be up so they can produce breast milk, right? Older adults, I know they're gonna have the worst side effects, right? They may be dizzy, I worry about them falling, all of that, okay? So loop diuretics.
Loop make it lose potassium.
All right. So these are our, like furosemide, torsemide. So our major one is furosemide or Lasix, okay? Of course, it's going to do the same thing that your thiazide diuretics do, right? The thing is, with loops, what makes loops different?
They pull off a lot of them.
They pull off a lot of potassium, okay? They work a lot faster than thiazide diuretics as well. They're stronger than thiazide diuretics, okay? They're a lot stronger, okay? So if we have a patient and let's say all of a sudden they start having like too much fluid around their heart and lungs, what would I give them? A thiazide diuretic or a loop diuretic?
A loop diuretic.
Because I need to pull that fluid fast, okay? Now, when I'm giving that loop diuretic, it's gonna work fast. So what am I gonna be watching for?
Urine blood pressure.
Blood pressure
Blood
drop.
gonna drop, they're gonna be dizzy, I'm worried about safety, all that stuff, right? And again, loops make you lose potassium. So anytime somebody's on a loop, I automatically tell them, look, I need you to increase your potassium. But I already eat, no, it needs to be increased, because loops is definitely gonna make you lose it, okay? And a lot of times they have to be on a potassium supplement, okay? So again, loops work just like thiazide diuretics.
So would they have to be on both, a potassium supplement and increase their potassium, intake?
Sometimes, yes, because loop, like you lose a lot of potassium. Okay, so side effects are just like thiazides, except it's more. You're gonna lose more fluid, you're gonna lose more sodium, you're gonna lose more potassium. You lose a little bit of calcium, but the greatest concern is potassium, okay? Again, we worry about them fainting, falling, muscle weakness, irregular heart rhythms, ototoxicity, okay? Hyperglycemia as well. Why do you think they become hyperglycemic? They have more sugar in their blood. Why do you think? Because I'm pulling the fluid out. So if I'm getting rid of the fluid, I end up with more sugar because I'm taking away the fluid. Make sense? All right. So when I'm giving loop diuretics, just like thiazide, so if I'm studying, I know that thiazide and loops do the exact same thing, except loops, you're gonna lose more, okay? So again, I'm gonna check those potassium levels first. If it's low, I'm gonna call the doctor and say, look, their potassium is too low, I can't give them this loop diuretic, okay? If they're taking any other ototoxic drugs, but the main concern is potassium. What's the main concern? Potassium. Of course, after I give it, what am I also checking? Potassium levels again, okay? And if they have to get supplements, then I wanna make sure that I give those supplements, do a whole lot of patient education. Because it is ototoxic, I check for like hearing loss, ringing in the ears, okay?
So a loop diuretic itself is ototoxic?
Mhm. Tell me why. How does hearing work? Fluid in the ears. So when we're removing all that fluid, it can impact the ears. Make sense? So if you understand like how things, y'all took anatomy, right? I keep asking y'all about that. So if you understand anatomy, then when we talk about these medications, it makes more sense. Oh, there's fluid in the ears, it has to have a certain amount for you to hear and do all that kind of stuff. If I'm pulling fluid, then I may impact that. Make sense? Limit alcohol. Why am I limiting alcohol?
Cause you're gonna get it already. Hydration.
Do y'all know how alcohol causes dehydration? So alcohol blocks ADH. ADH is anti-diuretic hormone. Anti-diuretic, so diuretic makes you pee, right? So anti-diuretic makes you do what? Stop peeing. So alcohol blocks ADH. So if it blocks ADH, our body, after a while, our body says, okay, I don't need to lose no more fluid, so it sends ADH out there to say, all right, stop peeing. Cause I don't want you to dehydrate me.
I don't know what look at it.
But alcohol,
Because baby, I be
After a
peeing.
night of that vodka, that next morning, be dry
yeah,
and
you pee
thirsty.
more when you drink because it's blocking ADH.
Oh.
So it's instead of your body saying, okay, that's enough pee, when you're drinking alcohol, it blocks that hormone that says.
Got it. Okay.
Oh, okay.
I misunderstood what she
Yeah,
said.
so you pee more.
Yeah.
Does that make sense?
Yeah.
Alright.
Yeah.
Just FYI, that's what alcohol does, it blocks ADH.
I'ma remember
And I
that.
don't have to
Pee,
so
right.
it blocks that. So instead of stop peeing, you peeing all night.
Mhm.
Okay? So it says limit alcohol when you're on a loop diuretic. Why? Because alcohol, what you're doing, peeing. So you're gonna be dehydrated. Alright? It says exposure to sun. Why am I worried about exposure to sun?
Dehydration.
Dehydration. So y'all, every issue with diuretics is mainly what?
Dehydration.
Dehydration. Okay? So no matter how I ask the question, the major issue is what? Dehydration. Okay? You got me, Chelsea?
I
No
got
matter
it.
how I ask it.
No, you can ask it. You can ask it.
Yeah, I'm just saying no matter how I ask it.
Oh.
Right.
I thought you said you weren't gonna ask it. I was like, I mean,
No matter how
I
I
ain't
ask
telling
it.
you what to put on the test.
Okay? Potassium supplements, right? I'm looking at potassium supplements, okay? I may want to increase my vitamin K, but the main thing is potassium. What's the main issue that they're losing?
Potassium.
Because loops make you lose potassium. I better see y'all head bobbing on that test.
It's only gonna be one question. That's gonna be
Several questions y'all just don't realize. All right. Most of the time. So, pediatrics, I already know it's based on their weight, right? Pregnancy, not recommended. Again, why? I don't want them losing all that fluid. Make sense? Older adults, same issue with thiazide. What's the biggest issue? Falls, dizziness, dehydration. Okay? All right. So what I asked you about potassium sparing, you wanted to know all right? There's spironolactone or aldactone is the trade name. Okay? This is the main one that we get.
What they change that for?
I thought that was for like acne and PCOS and stuff.
Yep. So if this medication falls into two classes, all right? It falls into an aldosterone inhibitor, but it's also a potassium sparing diuretic. So remember I said, so one of the non-rights is the right reason, because medications can be all given for different reasons. So this is one of them. But in this case, it's a potassium sparing diuretic. So although they're taking it for acne, what else is gonna be happening? They may be losing fluids as well. Okay? All right, so it's gonna conserve potassium. They're gonna hold on to potassium. They're gonna keep potassium, all right? Of course, they're still gonna lose fluid, but the only difference here is what? They're gonna keep potassium, okay? All right,
But don't tell them to increase it.
I don't want them to increase it, no. I don't want them to increase their potassium, because they're keeping it.
Right.
When they have too much potassium, that's really hard on the heart, okay? Make sense? Questions?
So you would give that to a patient with heart issue? Like, why would they prescribe that as opposed to?
The regular one.
It just depends on how much fluid they need to lose and what their potassium level is. So let's say that I have somebody that was on a thiazide diuretic, but they just keep losing too much potassium. This will do the same thing.
For
It
the
comes to
fluid,
losing-
but maintain their potassium
Correct.
normal.
Make sense?
So it's not the first choice?
No.
No.
It just really depends on the patient, their labs, all that. Make sense? If they already have heart issues, let's say they have a dysrhythmia, so their heart does not beat in normal, rhythm. I don't wanna give them something that's gonna take away their potassium, because it's gonna make that rhythm even worse, okay? So I wanna give them something more like this, because it's gonna keep their potassium and it's not gonna make their rhythm worse. Make sense? Again, because they're losing fluids, they're gonna have those same fluid losing type of side effects, right? The only difference is, what are they keeping? Potassium. Okay, of course, I wanna check their electrolyte levels. And in these patients, I wanna monitor for hyperkalemia or increased potassium, right? Because they're holding on to so much potassium. So I tell them to avoid excessive amounts of potassium. All right, so I still educate them about potassium, but it's the opposite. Instead of saying, I need you to eat more bananas, more cantaloupes, I tell them, don't eat a whole lot of bananas, don't eat a whole lot of cantaloupes. Make sense?
So things like magnesium and calcium and stuff, iron is okay?
So why isn't this one the issue with sun?
It still is an issue with the sun. All right, anytime you're losing fluids, it's always an issue with dehydration. Anything that makes dehydration worse. All right, same thing here, okay? Same side effects, most of the time with pediatric patients, if they have to be on it, of course, it's gonna be by their, weight, okay? So pregnancy and breastfeeding. If I have to have a patient that's pregnant, they just have to be on a diuretic, this is the diuretic that they're gonna be on, okay? They're not gonna lose a whole lot of fluid. It's not as much fluid as like Lasix or thiazide. They're gonna lose a little bit, but, it's not as much. And it's safer than the thiazide diuretics and the loop diuretics, okay? And of course, older adults, what we worry about, falls, all that stuff, safety, okay? Questions? All right, I'm gonna go back to osmotic diuretics, and I told y'all I want y'all to know about osmotic diuretics. So the only osmotic diuretic that we give a lot is called mannitol, okay? Called mannitol. Mannitol is not given for hypertension or nothing like that. Osmotic diuretics, what's the root word in there? Osmosis, right? What does osmosis mean? So it's extreme movement of water. So with osmotic diuretics, they're gonna lose a whole lot of fluids, like a lot. So it's only used when they have increased fluid in the brain and when their kidneys aren't working. I'm trying to trick their kidneys to start working. So the only 2 times that I use osmotic diuretics is when they have too much fluid on the brain, or I need to trick their kidneys into working again. Does that make sense? Because it's gonna pull a whole lot of fluid out. So somebody who has blood pressure issues, are they gonna get an osmotic diuretic? No.
Is your kidneys filtering as normal the same thing as them not working as they should, like at all? Like if you're retaining so much, is there a difference in that or no?
Yes, because your kidneys do 3 things. It filters, it puts stuff back into the body, and it excretes. all right? So let's say that our kidneys just aren't working, okay? It's not doing anything, especially excreting. I'm gonna give them an osmotic diuretic to trick it to make it start excreting again. Does that make sense? When somebody has like fluid on the brain, like that's a problem. Like that's an extreme problem. I need to get that fluid off the brain. I'm gonna give them an osmotic diuretic because it's gonna move a lot of fluid very quickly, okay? Osmotic diuretics are given IV, okay, of course, right? Because I'm talking about fluid on the brain, and I'm talking about kidneys that aren't working, okay?
It's only given IV?
It's given IV, it's mannitol, given IV. MANNITOL.
God bless you.
Thank you. So it's given IV and it's given with a filter, okay? So we gotta put a filter on that IV tubing because sometimes when mannitol hits the air, it'll start crystallizing, okay? And I don't want those crystals to go into the patient's veins, right? But let's say I go and get a bag of mannitol and I see that it already has crystals in it. Do I use it? I'm gonna put a filter on it anyway. Right, if you see that it's already got crystals, throw it out, okay? But mannitol is given IV, always with what? A filter on it, okay? What's the two reasons we use mannitol?
For fluid on the brain.
Fluid on the brain,
Or
and
kidneys.
the
Kidneys
kidneys
not
won't
working.
work, to try to trick the kidneys into working, okay?
So what happens if the crystals,
What's that? What?
crystals,
That's like having, glass in your veins. That's like you're gonna die. Okay? All right, so osmotic diuretics, that's usually in ICU settings, okay? Because they got fluid on the brain, we got kidneys that's not working, all right? All right. So remember I said this chapter is talking about medications that impact the urinary system. So either it's gonna make you urinate or it's gonna kind of stop it, okay? So overactive bladder, y'all seen those commercials, right? Gotta go right now.
How I feel right now, gotta go now.
And I don't have, they sell those commercials. All right, so overactive bladder, it means that anytime your bladder feels even like a drop of urine, it feels like it needs to go, okay? And sometimes that's a problem for people, why?
it's
It's
activated.
It's activating, you see how busy? It's like a kid, mama, right? So what our main thing is, sometimes we give urinary antispasmodics, okay? So this is like a normal bladder, all right? Usually, they have to be full and then they'll trigger us to go to the bathroom, right? But somebody with overactive bladder, it don't even have to be a whole lot, and the bladder's like, all right, I gotta go. That's you?
That's me right now.
All right? So the main medication that we give for overactive bladder is oxybutylin. Okay? It's the main medication that we give for overactive bladder. All right? So, why are we giving it?
To relax the bladder wall.
To relax the bladder wall. I want them to have decreased urinary frequency, decreased urgency, and decreased incontinence. So y'all know what incontinence means, right?
Yes.
You have accidents. Sometimes when people have overactive bladder, the bladder's like, I'm not listening to you.
I'm going now.
Right now, okay?
Listen to this, buddy.
All right, so what's the main medication that we give for overactive bladder?
Oxybutylin.
Oxybutylin. And what it's gonna do? Relax the bladder so you can, hold more fluid, so every little drop you're not going to the bathroom. Make sense?
Question. So that is me. I go constantly and it's not a whole lot when I do go. But at the same time, I retain a lot of fluid as well. So would that be something that I would even consider getting, or do I wanna keep going and getting rid of what I can get rid of at the time?
You want it to be a healthy balance.
Mm-hmm.
So even when you're getting like a little bit of drops at a time, something's still going on to where you're retaining fluid. So you gotta address both issues. One, you're not really excreting well if you're only getting out like little drops at a time. Like
And
you're
if-
not excreting well.
And if old urine, like if your urine stays in there, then you get
You're more prone to getting bladder infections,
the
yes.
oxicity, or like, can you get built up like acid or whatever in your urine?
No.
Like if you're not filtering like you should, or if you're not excreting and it just stays in the bladder.
Then it goes from being an acid to alkaline,
Right.
which means now you have bacteria that can start growing, which is why people have, UTIs, because it just sits there. So yes, it's still something you should consider, even if you retain fluid. So a lot of times they'll give like a diuretic and an antispasmodic. So your kidneys are still gonna create more urine, but now your bladder can just hold more of it. So when you excrete, you can excrete more than just a
And they
little
did
drop.
put me on a diuretic and I just cannot function that way.
It's very hard, especially when you work.
Mhm.
And so, see, you feel me? That's why I was going back to my doctor. You don't want to look at me, but yeah, it's very frustrating for patients as well. So you'll come in and you'll see a patient and they're still complaining about the same symptoms. It's like, well, you prescribed this medication, yes, but it's not really working with my lifestyle. So that's where just patient education comes in and just kind of helping them to develop a plan to where they can best utilize the medication. Make sense? But it is frustrating, especially when you work.
Yeah, because I mean, just my normal, at least every hour, I'm going. You put me on a fluid pill every 5 to 10 minutes, I'm going, and that's with me holding for as long as I possibly can. Add alcohol into the mix, I'm every 3 minutes. I make it. So
It's a lot.
It's hard.
You know what, and they don't do it much anymore, but what they used to do for patients like that was offer a leg bag,
Yep.
like a Foley leg bag, especially if you have to go out that many times and you have to be on a diuretic and you have to work. And the leg bag is very discreet.
But it's small.
It's small,
And it fills
right.
up quickly.
So you still have to be going every so often
Mhm.
to increase
Empty it out.
to dump out the bag. And the problem with Foley catheters too is the risk for UTI.
Yeah.
But it worked for patients who had to work, but again, there's that risk of UTI.
Yeah.
So now when we're thinking of patients, we're gonna think about Miss Shannon. So we got the non-compliant, are you compliant with your medication?
No, she just told you she won't comply with taking the fluid pills.
You said that, didn't
Well, but I couldn't, like,
It's
I
very
could
difficult.
not. It was painful.
you? Mhm.
It was to the point where it was just painful.
So y'all, these are good examples, so when we get into practice and we have patients who are like non-compliant or non-adherent, we have to be a little more understanding because sometimes it's hard to follow those doctor's orders. It's hard, especially when you work. And then sometimes you have doctors and nurses and healthcare professionals say, well, you wanna get better, don't you? And it's not that easy, all right? So nurses are the ones who have to kind of bridge that gap and have like that understanding to kind of help them to come up with a plan. But sometimes there is no like effective plan when you have to work. I'm sorry, that's a lot. Right. So with urinary antispasmodics like oxybutynin, we may end up with like dry mouth, dry eyes, headache, dizziness, okay? You may have like chest pain, irregular heart rate. Sometimes we may have some edema. Why would we sometimes have edema?
Cause you're retaining it.
So not sometimes we may start retaining fluid, so it gotta be like a balance, okay? So if a patient starts retaining a whole lot of fluid when they're on oxybutynin, what should they do? Contact the physician, right? Because we gotta work on that dose, okay? Or we may have to put them, like Ms. Shannon, we may have to put them on oxybutynin and now a diuretic as well. Make sense? All right, so before we give it, of course, we're gonna check the weight, heart rate, blood pressure. All right, we're gonna look for those adverse effects like chest pain, irregular heart rate. We wanna check that blood pressure, okay? Monitor INOs, okay? Because I wanna make sure that they're not losing too much fluid, but the main thing is I wanna make sure that they're not starting to retain fluid, okay? So sometimes the biggest issue with antispasmodics, they start retaining fluid, especially if their dose is too high, because now we've really relaxed the bladder. The bladder's like, what you want to do? Okay?